यस हेलो दोस्तों, आप सबको मेरा प्रणाम. हाय, हेलो एवरीवन. Am I audible and visible? How are you, all of you? How is your preparation going on? How is your third year preparation going on? Yes. Okay, Hemant, Dhananjay, Lion, Dr. Sinch, Narasimha, Priyanka, yes, Vinay MR, SJ, Aishwarya Baligar. So good evening all. Good evening. So today's topic is most expected questions that can be asked in your third year university exam. So that is sexual jurisprudence. Okay. So like example, natural sexual offences, unnatural sexual offences, criminal abortion, medical termination of pregnancy, infant death, and this is very important topic, very commonly asked in INA-CET, your NEET PG, and other entrance exams. So very commonly asked in Viva as well. So welcome to Farre Series, the second day, sexual jurisprudence. Yes, Dhananjay. Okay, let's start. So from the beginning, I have a question for you. So all of you guys, let's start with a very interesting question. Okay, in Indian scenario, in Indian scenario, only man can be charged for raping a woman. True or false? Okay, husband, wife, or male, female. So in India, only the male is the offender, not the female. Is it true or false? Okay, yes, fine, good. So in general it is true, except some sections of POCSO, that is Protection of Children from Sexual Offences Act 2012. So it is true basically. So in Indian scenario, only a man can be charged for raping a woman, but not vice versa. Not vice versa. Okay? So okay. So with this now, so let's start. So this is one very important question. Shubham Kumar, Dhananjay, Hemant, concentrate. Sagnik, Mondal, define rape. So remember, rape is a legal term. So we need to define properly. Define rape. Mention 7 descriptions. 7 descriptions. And explain about victim examination. Very commonly asked. Okay. Fine. Okay. So let's start. So in exam, we need to define properly about rape. Rape is defined as the penetration, insertion, manipulation, and application. And also you need to write about types of rape. What is the legal age for giving consent for sexual intercourse? So in exam, university exam, you need to start like this. If you want distinction, if you want more mark in upcoming university exam, you need to start like this. Definition of rape. So the word rape, it has come from a Latin word rapire. Rapire. The meaning of this word rapire is carrying off woman by force. Actual meaning is seize. So rape is equal to rapire. Rapire is equal to seize. legally in India, it is defined under section 375 IPC. 375 IPC. So IPC means Indian Penal Code, that is now outdated. So, and as well as 63 BNS. 63 BNS. Okay, so all of you write in the chat box. 63 is equal to definition. 64 is equal to punishment. So please write this in the chat box. Yeah. According to 63 BNS, a man is said to commit rape if he, so it is clearly given here, a man, not any person, a man. So that's why 63 BNS applicable only to male, not the female. Okay, the POXO is different. Okay, yes, if he penetrates, the mnemonic is PIMA, P-I-M-A. So P for penetration, I for insertion, M for manipulation, A for application. So you need to write properly penetration of penis into vagina. So vagina means it can be partial penetration, complete penetration. So urethra, mouth and anus. So penetration into vagina, urethra, mouth and anus. So the mnemonic is V-U-M-A, UMA. Write this in chat box, UMA. Not UMA, UMA you write. V, that is vagina, urethra, mouth and anus. So that is sodomy also. Or oral sex also can be a punishable offense. UMA, all of you write, keep writing UMA. Yes, good. So that is about the part 1 of the definition. The part 2, insertion. Insertion of any object. Any object. Can be finger, can be any object other than penis into vagina, urethra and anus. So here only V, U and A. U. U, only U. So M is not there here. Mouth is not there. So this is what you need to write in the exam. Then manipulation of body of the victim to cause penetration. The manipulation means applying force. Applying force to commit the offense rape. Application of mouth into vagina, urethra and anus. So 4 keywords are there. 4 keywords. So penetration, insertion, manipulation, application. The inner sex is known as sodomy. The oral sex is known as sin of Gomorrah. Okay? Oral sex is equal to sin of Gomorrah. Commonly asked. So one more very important point here. So my question is, all of you, touching labia majora. Touching labia majora or slight touching of labia majora, is it rape or not a rape? Okay. So question is touching labia majora. So there is no penetration, there is no full penetration, there is no partial penetration. Slight touching the labia majora, LB, is equal to rape. True or false? Just write true or false. Just say yes or no, or true or false. So Madhumala Verma, great. So Madhumala, Ilyas, MBBS. You getting my point? Labia majora, minora, hymen and all. So touching labia majora is equal to rape. True or false? Asked once in INA-CET exam. Atif Hussain is telling sir no. Vinay MR is telling sir true. it is true. It is true. It is given in standard textbook. It is given in 63 BNS. It is true. Okay. Yes. So this is one more point. Then there are different types of rape. Types of rape commonly asked. Types of rape. So there are basically 4 or 5 types. One is statutory rape. Statutory rape. When age of the victim age less than 18 years, then that is known as statutory rape. The second one, stranger rape. Stranger. Like example, Nirbhaya case. Acquaintance rape. Acquaintance rape. So is a condition where the accused is known to the victim. Then it can be gang rape. Gang rape. One more type, date rape. Date rape. Date rape. So can anyone answer what is the drug that is used in date rape? Yes. Come on, guys. What is the drug that is used in date rape? After taking the drug, the female victim become unconscious or disturbed state. So can you name one drug which is used in that condition? Alcohol, very good. Alcohol, yes. But answer I wanted is rohyphenol. Rohyphenol. GHP. Flunitrozepam. All these are date rape drugs. Ketamine also, ketamine, barbiturate, LSD, yes. But in general, rohyphenol or flunitrozepam. So it is commonly asked as a MCQ. So I'll repeat again. Whenever question asked definition of rape, you need to start like this. Latin word rapire, carrying of woman. Then 375 is the old definition and 63 is the new definition. Mnemonic is PIMA. Penetration in UMA, insertion in only PUA, and manipulation and application. So the legal age for giving consent is 18 years. Less than 18 years known as statutory rape. So there are different types of rape. Like example, statutory, stranger, acquaintance, gang, and date rape. So gang means more than one. So date rape drugs are rohyphenol. So and slight touching the labia majora, even without penetration, can amount to rape basically. So this is one very important definition. You need to mug it up, guys. Is it clear? Atif Hussain, Atif, Dhananjay. Is it clear? Say yes or no. Yes or no, guys. Very important question. Very important 3 marks question, 5 marks question, and the main question. So Kamlesh Yadav, we will have discussion later. Don't worry. Kamlesh, Lion, Vaishak Kotwal, yes. Hemant, Vinay MR, that's great. Then comes is 7 descriptions of rape. Very important. Descriptions. There are 7 descriptions. The description number 1, against her will. Against her will. The will means desire. Okay. So the will is formed in brain basically. We call it as cerebrum and others. So that is basically will is equal to desire. Desire. Point number 1. Without her consent. Without her consent. The consent means permission. Permission. So remember, will and consent both are not same. Will and consent both are not same. I said will is desire that is formed in the brain. When there is a desire, there is a consent. When there is a desire, there will be consent. Let's see one example here. Let's see one example. Now look at this. Very interesting scenario. So he is the boss. So boss of a company. Very famous company. And she is basically employee. Employee, say Pinky. Her name is Pinky. Okay, Pinky. And boss, Brownie. Okay, Brownie. So Brownie and Pinky. So now see, boss is telling, so I'll give you a promotion. I'll give you some extra salary to you. You just give me consent for sexual intercourse. She will agree. Okay, for the purpose of promotion, she agrees. She agrees. She says yes. Now my question is, what is there here? What is there? Will is there or consent is there? Or both are there? Yes, all of you guys. Will and consent. So my question is, what is present in this Pinky and Brownie case? Will or consent or both? Chalo guys. So Dhananjay is telling, sir, only consent. No will. Yes, very good. In this condition, there is no will. No will, only consent. Only consent. Now my question is it rape or not a rape? Yes or no? Just say yes or no. Don't write rape and all in the chat box, so YouTube might block you. So just say rape. Is it yes or no? Yes or no? Yes or no? Say after 1 or 2 years, so the female she feels very guilty. The Pinky is there, no? So Pinky she feel very guilty. Say look at this Pinky now. Okay, the Pinky feels very guilty, and she will inform her husband. So her husband will come to know what is happening basically. Then she will go to a police station and she will file a complaint. Now my question is, so does it really stand in court? Does it really stand in court? My question. Yes, definitely yes, definitely. So why? Because so when there is no will, the consent become invalid. So this word try to memorize. When there is no will, there is no consent. Okay? Yes. So this is what the importance of the two description. The next description is with her consent in fear of death or hurt. Fear of death. So fear of death or fear of hurt or fear of hurting a family member. So then with consent under impersonation. Either in darkness, like in train, or twins. So identical looking twins. Then with her consent under intoxication, like rohyphenol, alcohol and all. Less than 18 years of age. And last one, unable to communicate the consent, especially when she is unconscious or when she is deaf and dumb. So only such 7 descriptions very commonly asked. So in exam, you must write all 7 descriptions. So like this, 7 descriptions. Okay. Ciao. So now there are certain legal sections as well. So very commonly asked. Again, it is a fact-based question. So there are many facts in forensic medicine that you need to memorize, especially these facts. So section 63, rape. 64, punishment for rape. So punishment, again, it can be life imprisonment. It can be more than 20 years, like that. So 64 is punishment. Then 65, rape in certain cases. Like example, less than 16 years, less than 12 years. So less than 16 year, life imprisonment. Less than 12 year, death sentence. So all of you write in the chat box. Write in the chat box. Less than 16, life imprisonment. When victim age less than 16, life imprisonment. When victim age less than 12 years, then it is death sentence. It is also punishable under various sections of POCSO as well. So write this in chat box. Write this. Come on guys, keep writing. Then 66 basically. 66, rape and murder. Rape and murder. So how to remember 66? Murder you can see here. 6 alphabets are there. So all of you write 66 is equal to murder. So murder along with the sexual intercourse. Then 67, very important, 67, sexual intercourse by husband, okay, upon his wife, BB, okay, during separation. This word is important, during separation. When court case is pending between husband and wife, when husband, badmash husband, when he will have intercourse with her, then it is 67. Remember, it is during separation. During separation. There is no word marital rape in India. Okay. How to remember 67? So is equal to husband. So 7 alphabets. All of you write 67 is equal to husband. 7 alphabets are there. I remember like this. 67 husband, badmash husband. 67. Okay. Then 68, 69, 70 and 71. 68, sexual intercourse by person in authority. Okay. 68, the person in authority. So basically it is not rape, it is a sexual intercourse. Like example I said Brownie and Pinky. So basically it is the sexual intercourse by the boss with the employee by using his power, custodial power. So 68 authority, 69 like false promise of marriage, having intercourse with someone, with wife, with someone like that female, with a false promise of marriage. So false promise of marriage. 70 gang rape. Gang rape. You can remember G70. G70. 71 repeat offender. Repeat offender. Repeat offender. So all of you write in the chat box 70G, that is gang. Gang means more than one. So write this. Keep writing guys, keep writing. So all these are very important sections, very commonly asked in Viva, very commonly asked in Prof exam and INACT exam. So as an examiner, me examiner in RGHS. So these are all somewhat high-fi questions I do ask. So basically in Viva. Okay, yes. 71 repeat offender, glory to God, 70, that's great. Okay. Chalo, now you need to identify one by one yourself. Look at this. Look at this. लड़की के रेप दौरान मौत होने पर so what is the section for this? What is the section? So rape के दौरान death, that means rape and murder. So what is the section? Vaishak 66 BNS. So that's great. So first to answer is by Vaishak. Very good, Vaishak. So Vaishak, excellent. The next question. Look at this. पति के रेप करने पर सजा कितने होगी और कितनी होगी? What is the section for that? Husband and wife, I said. What is that? Yes, Vaishak. Yes, now Sutapa, Samantha. Very good, Sutapa. Excellent. So 67. So husband and wife during separation. Okay, during separation, this is important. Without consent. With consent, no problem. Without consent, definitely problem. During separation. Great. Next, let's look at this. Look at this and try to answer. Look at this here. Again, Brownie and Pinky. Brownie and Pinky. So, giving false promise. That is Shadi, a marriage. False promise of marriage. Jhuta wada. What is that basically? 68? No, it is not 68. It is not 68. 68 is authority. Authority, authority. 65? No. Now here our Pinky age is more than 18 years. So Pinky age is more than 18. So say example, boy more than 21, girl age 18 or more than 18. So now there is a consent, there is a will, but false promise of marriage. 65? No, 65 में नहीं है. Yes, it is basically 69. 69 and also under POCSO if less than 18 years of age. And the last one, look at this, more than one person. More than one person. That is known as gang rape. So gang rape करने पर कितनी सजा? That is what given in 70, है ना? 70. So that's great. All are answering. So now in exam, very commonly asked practical exercise is victim examination. So victim examination, very important. Okay. So medico-legal report on victim examination. Just a minute. Yeah. So in exam, victim examination very commonly asked in the Viva and also in practicals. And this is very important exercise you must know as a doctor. So doctor is an expert witness. So as a doctor, you must know how to write examination of victim of rape report, accused, wound certificate, death certificate, postmortem certificate and all, because you are expert witness. So doctor is an expert witness. So victim examination comes under 184 BNSS. BNSS, that means Bharatiya Nagarika Suraksha Samhita. So write this in chat box. So victim examination is equal to 184 BNSS. Previously 164 CRPC. Now it is 184 BNSS. Keep writing. Keep writing. So in exam, generally you need to start with the general particulars. General particulars, name, age, identity, address and all. But remember, never ever disclose the identity of the victim to media or any person. That is punishable under 72 BNS. 72 BNS. Never disclose. If you disclose, then it is a punishable offense. Punishment can be 72 BNSS. The punishment is 72 BNS. Punishment is 2 years of imprisonment. Okay. So identity is equal to 72 BNS. Again MCQ. 72 is there, 2 years of imprisonment. Then inform police. Our first duty in any case of rape is to inform police. Just call police headquarter, and you just inform the police about the offense. That is mandatory. That is mandatory in POCSO Act as well. So that is about the general particular. Then very important is consent. Consent. Now my question is, can you examine victim without her consent? I'll repeat again. Can you examine the victim of rape without her consent? Yes or no? Yes or no? Glory. Yes or no? No. Excellent answer. No. Never ever examine the victim of rape without consent. Only with the consent, not without the consent. That is clearly given in 184 BNSS. Okay. So when victim is not giving consent, then you can document informed refusal. You can write in the case sheet, so and so, the pinky is not giving consent for the medical examination and also sample collection, and the consequences has been explained in her own language. Then you can take the signature and the witness signature. So that is asked in your INA-CET as well. Informed refusal and informed consent. Then identification mark, the birthmark or tattoo mark or any scar mark. Then presenting complaints like pain, abdomen, bleeding, pain, injuries, psychological trauma, everything that you should mention. Then history. So what happened in the case? So what was the time? How many members were there? So all this history you can take briefly. Then examination. Basically general examination. Then local examination. Local examination for Hymen tear. Hymen tear. So Hymen tear is very important evidence in case of virgin. My question is, what is the common site of Hymen tear? What is the common site of Hymen tear? For example, this is Hymen. So this is Hymen. Okay. Hymen. The hymen is a mucosal fold around the vagina. What is the common site of Hymen tear? So this is, say, example 12 o'clock position. This is 6 o'clock position. 6 o'clock position. So that is basically posterolateral. Posterolateral. And one more point. In case of insertion of finger, finger penetration, then it is anterior. One more important viva question. In case of children, Hymen tear is very uncommon. Why? Because Hymen is deep-seated. The children, it is deep-seated. So 3 MCQ all of you. I'll just revise. Posterolateral, anterior, and deep-seated in children. Very important. And to identify Hymen tear, we use a rod. We use an instrument, small instrument, that is known as GK rod. GK rod. So all of you write in the chat box. GK rod. GK means not general knowledge. Gleister keen rod. Gleister keen rod. Keep writing. So all these are MCQ. Okay. So this is okay. Then toluidine blue. So you can apply toluidine blue over the labia majora, minora, and areas. Any micro injuries. So that is detected by toluidine blue. So toluidine blue, micro injuries. Like, you know, any injury, DNA, RNA comes out from the cell. So this DNA, RNA stained by toluidine blue. That is asked in your exam. Then genital injuries. So whenever there are genital injuries, that shows forceful penetration. Whenever there are physical injuries, that shows force, general force is applied. So that is the meaning of that. Then investigation, free treatment. So government hospital or private hospital, free treatment should be given to the patient. Then otherwise it is punishable offense. Collection and preservation of samples. Very, very important. Okay, all of you guys, prof exam, what are the samples collected? So samples are collected in safe kit. Safe. Sexual assault forensic examination kit. Very important. Very, very important. Safe kit. Then you can give provisional opinion immediately. Then you can give final opinion after getting report from FSL, after getting a report from histopathology, you can give further reports. So this is about the examination of victim of rape. So there are basically 10 steps are there. 10 steps. Okay. That's fine. That's okay. Chal. Next. What are the specimens to be collected? One is scalp hair, blood stain, seminal stain, bite mark, blood, foreign material, urine, nail scrapings. So all is a specimen. So this is 3 marks question. 3 marks. So what are common injuries? Head injury, black eye. So black eye, that is the spectacle eye, that is hematoma around the eye. There can be buccal mucosa tear. Okay, teeth dislocation. Yes. Abrasion, bruise, very common abrasion, bruise. Bite mark, especially over the breast and the genitals. Defense injury, so there can be defense injury. Broken fingernail mark and abrasion, bruise and all. So all these are basically injuries, all these are basically specimen. Okay, yes. So all these are basically defense injuries. You can see the surface injury here, surface injury. Lip bruising. Sixpenny bruises are fingertip bruising. So this is safe kit. Sexual assault and forensic examination kit. Now I have a question for you. Now I have a question. Sutapa, look at this now. So during examination, there are some abrasions are there. So there are abrasions. Can be graze abrasion, can be patterned abrasion, and there are bruises are there. Bruise is there over the right arm. So right arm there is a bruise. Hymen tear is there. Laceration at the thigh. Semen is present. Semen is present. So a case of gang rape during examination. All these are findings. What is your final opinion? What is your final opinion? Come on, guys. Come on. Yes, Vaishak is telling, sir, forceful penetration. Very good. So it shows forceful sexual intercourse. Sexual intercourse. Forceful sexual intercourse with violence. With general violence. Recent sexual intercourse. Okay. Recent forceful sexual intercourse with findings of general violence. So this must be the report. This must be the report. Okay, so that's okay. That's fine. Okay, the second question, this is asked in your prof exam. So go through this question and try to answer. A 14-year-old girl was brought to hospital by her mother with an alleged history of forceful vaginal intercourse by neighbor. So neighbor, so it is an acquaintance rape. She was examined by the doctor, found seminal stain over the internal external genitalia. Injuries are there over the genital region. Bite marks are present. Doctor collected evidentiary material. The question, there are 3 questions are there. Question number 1, whose consent should be taken for medico-legal examination? Give reasons. So whose consent is needed in particular case? Genital findings and what are evidentiary material? So evidentiary material already we discussed. So now here, so the age is 14. Age is 14. So what would be the best answer? Best answer. So POCSO, inform the police, very good. Inform police. It comes under section 4. Section 4 of POCSO. The second thing, the consent should be taken from the girl because more than 12 years. So girl can give consent for the medical examination, and you can also take the consent from the mother as well. Less than 12 years, you can take the consent from the mother. Okay. So then treatment, very good. Treatment, free treatment. And don't reveal the identity. Okay, identity. Don't reveal the identity. So all these are our duties. Okay, chalo. Dhananjayam, that's okay. Vinay, victim consent. Very good, Vinay. So victim consent. That's great. So the next question, very commonly asked question is, classify sexual offences. Very simple question. Natural, unnatural, and sexual perversions. Okay. So classify sexual offences. 5 marks question. So you need to write like this. It's a old classification. So old classification also you can write. New classification also you can write. So it is classified into natural. So natural example, rape, adultery, and incest. So rape can be natural. It can be unnatural also. So now even sodomy, oral sex also can be rape. So it can come under both the examples. So unnatural, sodomy, lesbianism, bestiality, buccal coitus. Sexual perversions, fetichism, transvestism, sadism, pedophilia. And sex-linked offences, indecent assault. So this is the classification you must write. Yes. Chal. Next. Can anyone identify this sexual offense? Brother, cousin brother, and sister. So my question is, sexual intercourse between blood relative like brother and sister, mother and son, or father and daughter, what it is known as? What it is known as, and is it punishable or not? Is it punishable or not? So this is known as incest. Incest. Incest can be of 3 types: Oedipus complex, Electra complex, Pharaonic complex. 3 marks question. Oedipus, Electra, and Pharaonic. And this is not punishable. Not punishable in India. It is not punishable in India. Good. Vaishak. So Prakar, Bimsara, great. So it is not punishable. That's okay. Chalo. Next. Look at this image and try to identify sexual intercourse with animal, especially dogs, sheep, cats, okay, sometimes cows. What is this known as? What is this known as? What is this? Yes, Vinayamar, very good. So this is known as bestiality. Bestiality. So one more image based question. So it is a sexual perversion. So he is basically brownie, and we have Pinky, and we have Pinky. So this Pinky is having a certain disorder. So Pinky gets sexual pleasure by looking at the tattoo. So by looking at the tattoo all the time. So inanimate object. So it is a sexual perversion, sexual gratification by using inanimate object. What is this known as? Can anyone tell me what is this known as? Try. Yes, so this is known as fetichism. Fetichism. So good. Great. Then I have one more picture. The picture of sexual perversion can be a 3-mark question. So a male acting like a female, and wearing a dress of female to get sexual gratification. So what is this known as? What is this known as? Lion, Prakar, SJ, what is this known as? Mohammad Ayush, very good. So this is known as transvestism. Also known as eonism, cross-dressing. So it's a sexual perversion. That's okay. Then one more sexual perversion here. Very interesting. Look at this, all of you try to answer. A female, we have Pinky here, Pinky. So Pinky is using lavatory or using some change room, and he is our bad man Brownie. So Brownie is recording the Pinky's video and also taking the images, and he is having that habit since childhood. He is having that sexual paraphilia, abnormal sexual behavior since many years. What is this known as? Muhammad, others, what is this known as? Yes, so this is known as scatologia. Scatologia, or you can say peeping Tom. Peeping Tom. The another name given to that is, okay, voyeurism. Voyeurism. So all these are commonly asked. Peeping Tom. That's great. Fine. Okay. Now there are some MCQs very commonly asked in your exam. You just try by yourself. So we started with the definition of rape and what are types of rape, 7 descriptions, victim examination, and also we discussed about the important BNS sections and all. So all of you guys, have you understood? Say yes or no? Yes or no, guys? So all of you guys, how is the Josh? How is the Josh in forensic class? Are you getting my point? Yes, guys. Vinay, Dhananjay, Swati, Vinay, Sinch. Okay, that's great. That's great. Hi, very good, guys. Very good. Now, so I have a question for you. You need to answer. Some MCQ asked in the university exam. A 24-year-old man gets married with a 16-year-old female. 24-year-old man with 16-year-old female. Having sex with her will be considered rape if case is filed within 1 year of marriage, because no consent taken from the wife age less than 18 year, wife age less than 21 year, wife age less than 17 year. So Vaishak and others. So the answer is wife age less than 18 year. So the first to answer by Mohammad Ayush. Ayush, excellent answer. But case should be filed within 1 year. The next question. So try to answer. Next question. Husband had intercourse with the wife during judicial separation without consent. Section which deals with it. 63, 66, 67, 68. 68 authority. 63 definition of rape. 66 rape and murder. 67 is the correct answer. 67. So good. The first two answer the given by Dhananjay. Dhananjay, great. Then following is used to document tear of hymen in a victim of rape. Vaginal speculum, Gleister keen rod, cylinder rod, Hagar rod. So answer is GK rod, B. So the first two answer by SJ and Dr. Sinch. Sinch, good. Most common position of hymen tear in a case of virgin. In a case of virgin. Anterior, anterolateral, posterolateral, posterior. So answer is posterolateral, right? So the first two answer. Lion. So Lion and Sutapa both. Sutapa, great. So now one more question for you, very interesting question. So I'll show you the question now. Example here. So just okay. So we have two personalities today. So he is our Brownie, as you know, Brownie, and we have Pinky. So Brownie and Pinky both are married. Both are just married. And Brownie came to know that Pinky is not virgin at the time of marriage. Pinky is not virgin at the time of marriage. My question, is it a ground for divorce or not? Is it a ground for divorce or not? Now see, Pinky and Brownie, they have very difficult relationship. So Brownie has a doubt and Brownie is telling, I want divorce because this is the problem. My question, is it a ground for divorce or not a ground for divorce? Come on guys. Come on, try. You can help our Pinky to come out of this depression and all. So you are legal expert, you are forensic expert. He is calling you, Dr. Saab. So this is the problem. You just help me. So my husband is torturing me like anything. So what advice you are going to give? Okay. Okay, guys. Yes. Not a ground, not a ground, not a ground. Yes, it is not a ground. Not being virgin at the time of marriage is not a ground for divorce legally. Okay. And one more thing, the wife can file a civil case of defamation if there is a rumors about her virginity and her defamation is there. Okay. So defamation. Good. Many answered. That's great. Many answered. That's great. Sutapa, Sinchana and all are answering. That's really nice. Okay. Then last one, last prof question. Then we'll discuss some more question, 2-3 questions. Then we will have image based session at the end. Okay. Next half an hour only. After that we'll have image based session. Statutory rape is. Just try to answer. Try to answer, guys. So good, it is less than 18 years. So that complete your one important session. So the next important question, very commonly asked, is describe new MTP Act. Medical termination of pregnancy. That is legal abortion. Legal abortion. Legal abortion is the right of female. Every female, married, unmarried, any female, one basic right is the legal abortion. Why? Because criminal abortion can lead to so many complications. So that can lead to death of the female due to vasovagal inhibition, septic shock. That's why MTP Act, so medical termination of pregnancy. So you need to remember the slogan of this: her body, her choice. Her body, my choice. So all I write in the chat box, MTP is equal to her body, her choice. Write this. So keep writing, guys. Keep writing. Tarak, thank you, Tarak. Fine. Let's see now MTP, medical termination of pregnancy. So what are indications? So what are indications? So very commonly asked. So there are 4 indications. So one is therapeutic indication. Therapeutic. So when mother is suffering from some serious illness, can be malignant hypertension, mitral stenosis, so she can ask for legal abortion, therapeutic. So therapeutic means mother. Okay. Second, eugenic. Eugenic means when fetus is having serious abnormalities, like example anencephaly, neural tube defects, eugenic. Third one, social causes, socio-economic causes, because of failure of contraceptive pill, the failure of contraceptive pill, social. And the last one, humanitarian. That is due to rape. So when rape is caused, when pregnancy is caused by the rape, then it is humanitarian indication. So therapeutic example, hypertension, not the normal hypertension, gestational hypertension, it's malignant hypertension. Eugenic, NTD, neural tube defects. Social, failure, OC failure, OC pill failure. So there are basically 4 indications. Now let's see. Up to 20 weeks. More than 20 weeks, 21 to 24 weeks. More than 24 weeks. So 3 important concepts. Can anyone answer? Up to 20 weeks, that means 5 months of pregnancy. How many doctors' opinion is required? Up to 20. Up to 24, how many doctors? After 24, how many doctors? Like that it is. Okay. So good, many answering. So Swati is answering very well. So Mohammed is also answering. Up to 20, 1 doctor. 1 doctor. Up to 24, 2 doctors. 2 doctors. More than 24, medical board. Medical board. So medical board consists of radiologist, pediatrician, gynecologist, and other social members. So what are the indication basically? Up to 24 weeks, indications are rape, incest, Disabled woman, minor, okay, minor. All these are indications. So I'll have to write in the chat box. So read M is a mnemonic. Read M more than up to 24 weeks. Up to 24 weeks. Read M. Rape, incest, disabled woman, and minor. Rid, R-I-D, rid M. Rid, get rid of me. Rid M also you can write. Rid M. Yes. Then more than 24 weeks. So 24 weeks means that is 6 months. So in India, viability is 7 months. So it is almost near to viability in India. So the only one indication is fetal abnormalities. So more than 24 weeks, fetal abnormalities. Fetal abnormalities. Okay, so this is very important. I'll repeat again. MTP Act, her body, her choice. Medical termination of pregnancy. It is implemented in 1971 and 72, and it is amended many times. So basically, it is to legalize abortion. Why? Because criminal abortion has many complications. There are 4 indications: therapeutic, eugenic, social, and humanitarian. And one example you must write. Then rules: up to 20, contraceptive failure, 1 doctor. 24 weeks, 2 doctors. Read M. More than 24 weeks, congenital abnormalities, especially NTD. Okay, so this is what you need to write. Now let me let me explain. Remember, this MTP Act is a liberal act, very liberal act. So when there is an emergency, you can do abortion, therapeutic abortion, at any time, at any place, at any time of gestation. So that's why I call it as liberal act. MTP Act is very liberal act. PCPNDT Act is very, very strict act. The offence is non-bailable. PCPNDT, sex determination. So I'll have to write, just write in the chat box, MTP is equal to liberal act. Very liberal. Matlab, punishment is very rare, and when doctor is doing legal abortion in emergency, it is not punishable. That's why we call it as liberal. But PCPNDT, very strict act. Very strict act. When doctor is involved in sex determination, then the police can arrest him even without warrant. Non-bailable and cognizable offense. Okay, good, Vinay. So that's great. All are answering. That's really nice. Okay. Now one more question is, for MTP, whose consent is needed? Now here there are 4 indications are there, you can make out. So now she is pregnant. So she is pregnant and she is unmarried. She is unmarried, pregnant. My question is, she is more than 18 years. More than 18 years. Whose consent is necessary to conduct MTP? So option A, father and mother. Father, mother, husband, or we can say boyfriend. Whose consent is required in general? Come on guys, Dhananjay, Vaishak Patwal, whose consent? Yes, SJ, very good. No need of husband, no need of anybody's consent. Only the mother consent. The pregnant consent is sufficient. Now I have one more question for you. Say example, age less than 18 years. Age less than 18 years. आपको पता होगा, when age less than 18 years, it has serious implications. Now my question, less than 18 years. So as per her Aadhaar card, her age is less than 18 years. Now my question is, what is your duty? What is your duty? Sutappa Samantha. Come on. Come on, try. Inform guardian. Yes, inform guardian, that's okay. Inform police. So that is important. Inform police. And if you want to conduct abortion, take the consent from guardian. Consent from guardian. Consent from guardian. That's why. So in MTP, so they will take all Aadhaar card, all birth certificate details and all. That's very important. Even in for USG also, they will take all the documents. Why? Because this is a reason. Okay. So that's okay. That's fine. Chalo. So this is, you can go through after the class. Differences between MTP Act 1971 and MTP Amendment Act 2021. So differences are given there. Just go through this. This notes I'll provide you after the class PDF. Just go through this. In MTP Amendment Act 2021, there is a imprisonment. There is a imprisonment basically when doctor is involved. So when doctor is involved, when doctor is not maintaining confidentiality. So confidentiality very important. आपको confidentiality रखना होगा. When it is not maintained, then it is 1 year of imprisonment. That is what given in MTP Amendment Act. So this is what you need to write. Chalo. This is okay. Then other questions, all of you guys go through these questions after the class given in Farre book. Hydrostatic test, very important. Recent signs of delivery in a woman at autopsy. Recently asked, very, very important. So what are recent signs? What are signs of pregnancy? 3 marks question, a 5 marks question. Causes of impotency in male. The causes can be psychogenic and organic. So most common cause is psychogenic and other causes are organic. Okay. So impotency. Impotency is a ground for divorce. If impotent husband at the time of marriage, then ground for divorce. Battered baby syndrome, very important. Battered baby syndrome. Then signs of virginity and types of hymen, very important question. Surrogacy, Surrogacy Act and ART techniques, 3 marks question. Seminal stain, sexual offences, seminal stain, Barberio test, Florence test, very commonly asked. Then sometime the question can be asked about POCSO Act as well, that is 2012. So all these are important questions, 12 questions. So go through all these questions after the class, very, very important. Okay, Dhananjay, Vinay MR. Okay, great. So now the last 10 minutes we have some image based questions. Like in some universities they ask image based questions like spotters. Okay, so all of you ready for the image based session? Are you ready, guys? Come on, ready? Say yes, all of you say yes. Muhammad Ayush, great. Sinch, Vaishak, Swati, SJ. Okay, so let's start. So first question. So for every question, around 30 to 60 second time is there. You just analyze and you try to answer. So one who answer correctly, so I'm going to write his name over the slide. So this is some interactive quiz type session. Okay. Yes, that's okay. Dhananjay, that's great. Look at this now. This is the question, image, and try to answer. So time starts now. Guys. Come on. Come on, guys. Try to answer. Your time starts now. 1, 2, 3, 4. Try. Yes. So you need to tell about what is this test, identify this test, identify, and what are other tests. What are other tests? Two things. Two things you need to answer. Try. Yeah. So what you can see here, yellow needle shaped crystals. So this is basically Barberio test. The yellow needle shaped crystals because of spermine peak rate. So this is presumptive test for seminal stain. So other tests are Florence test. Florence test. You will see dark brown rhombic crystals. Then we have acid phosphatase test. Acid phosphatase. So all is a presumptive test. So you can use Christmas staining as well. Christmas staining. So all is other tests. Okay. So the first to answer given by again by Dhananjay. Dhananjay, okay. Then Inch, okay. So many answered correctly. Sinch, good. SJ, good answer. So again 3 marks question. So that question can be asked. Now here types of hymen. So try to answer. 1, 2, 3, 4 and 5. So write the question number 2. Then you can answer all the 5 in a stretch. You can take 30-second time. 30-second time. So this is basically annular hymen. Annular. So what you can see here, central opening. This is multiple opening. Cribriform. There are 2 openings. Septate. Septate. This is imperforate. Imperforate. This is perforate. Perforate hymen. So other type is fimbriated hymen. Fimbriated hymen has artificial tears. It looks like a torn hymen. It has a notch. It has a notch. It looks like this. So notch. It looks like a torn hymen. GK rod is used. Common site of rupture is posterolateral. In finger penetration, it is anterior. Star shaped. Yes, good. So the answer given by Swati. Swati, good answer. Swati, finger like projection, that's great. Then I have a question for you from child psychiatry. So child psychiatry, so there are 3 important findings. All of you concentrate. Subdural hemorrhage, subdural hemorrhage, that is below the dura mater, retinal hemorrhage around the eye, encephalopathy, that is the swelling cerebral edema. What is this condition known as? So commonly seen in children up to 2 years of age. 2 years of age. Yes. Whiplash injury. So whiplash injury is seen in adults. So question here is, a child less than 2 years. Less than 2 years. So the answer is shaken baby syndrome. Shaken baby syndrome. So shaken baby syndrome characterized by retinopathy, subdural hemorrhage and encephalopathy. So this is nice. Good. Dhananjay answered, Sinch also answered, and Mohammad Ayush also answered. Vinay, all great. That's great. Next. The fourth question. This is a very interesting question. So all of you go through this. So here, same mother, twins basically, twins. So one belongs to father, DNA belongs to father, one belongs to some other male. So maybe boyfriend or maybe driver. So many cases reported in England. So what is this condition known as? The fertilization of two ova at the same time. Okay, what is this basically? So this is basically first to answer again by SJ. SJ, very good. It is superfecundation. Superfecundation. So the question can be asked in Viva. How to differentiate between superfecundation and superfetation? So your answer must be like this. So superfecundation, two eggs are fertilized by sperm from the different men, heteropaternal. But in superfetation, second pregnancy during ongoing pregnancy. So just an image, just to explain you, 5 months and 3 months probably. Superfetation, it's very rare condition. Atavism is a condition where the baby looks like grandparents. Atavism. So this is all very commonly asked. Good. Then this is fourth one. Then I have one more question, especially in forensic spotters. The image can be kept in exam. So pink feathery crystals. So my question is, what are the tests for blood stain? What are confirmatory tests? So there are some presumptive tests. So hemoglobin has peroxidase activity. When it combines with the reagent, it gives different color. So like example, what are the example? 1, 2, 3, 4. Confirmatory tests. What are the two confirmatory tests? Can see here pink feathery crystals are there. So what is this basically? Try to answer. Take your own time. So this test is basically Takayama test. Takayama. You can remember Takayama, mama, pink feathery crystals. Okay, pink feathery crystals. And a Teekman test. Brown rhombic crystals. Brown man is the mnemonic. So what are presumptive tests? One is Benjidin test. Benjidin, tetramethyl benjidin, phenolphthalein test, phenolphthalein test, then orthotolidine test, orthotolidine test, leucomalachite green test, leucomalachite green test. Okay, yes, good. So SJ, very good. So it is also known as Castle-Meyer test. That is the commonest test. The principle is peroxidase activity. Peroxidase. So good, SJ. Excellent answer, SJ. This is 3 marks question, commonly asked in INI CET. Just concentrate. Confirmatory, Takayama and Teekman. So in exam, so when it is asked as a 5 marks question, you need to write like this. Teekman test, reagents are sodium chloride, glacial acetic acid. So formation of brown rhombic crystals. So they are present singly or clusters. Teekman, brown man. Takayama test, known as hemochromogen test. Glucose is used, sodium hydroxide is used, and pyridine. Pink feathery crystals. Then we have one more test, Wegener test. Wegener test. So acetone Hymen crystal test. Acetone is used, and again here dark brown multi-shaped crystals. Multi-shaped. So this is 5 marks question. University exam. So all of you write Takayama, pink mama. Takayama, pink mama. Mama hai na, uncle mama, always nice na, nice mama, pink mama, flushed mama. Okay. Yes, guys. Vinay MR. Okay, that's okay. Then I have 6th question. You try to answer. Try to answer this. This image showing different steps: extraction, extraction enzymes, DNA sample, electrophoresis, transfer of DNA membrane, then X-ray. Now my question is, who has invented this? Who has invented this? And what do you mean by southern blot? What do you mean by southern blot? What do you mean by northern blot? And western blot. Western blot. Chalo, try answer. Keep answering, guys. So this is basically DNA fingerprinting. So one of the very commonly used technique in forensic medicine to identify the accused, to identify the murderer, to identify the paternity. So many cases, like example RFLP, restriction fragment length polymorphism. The principle is introns, VNTR, variable number tandem repeats, VNTR. Basically introns. So 3 questions are there. Invented. Can I answer anyone? Sutappa and others. Invented by. Yes, Naveed Naqvi. Naveed, Alec Jeffrey. Good. Naveed, very good. Invented by Alec Jeffrey. Southern blotting basically for DNA. How to remember? South Indian dosa. South, masala dosa. My favorite is masala dosa. South Indian dosa. North Indian. So I completed my MD from MEMC. Maulana Azad Medical College. So north matlab roti. North Indian roti, RNA. And Gen Z guys, you all Gen Z guys. Pizza. Western pizza. That is basically protein. So you can remember like this. South Indian dosa. North Indian roti. Western pizza. Pizza. Okay? All of you guys. Is it easy? Easy now? Good. Dhananjay, Vinay. You can write like this. South dosa. So just for fun. South dosa. Dosa. North roti. West pizza. Very commonly asked in Viva. Very commonly asked in basically INECT exam. Just write this. It is Priyanka. Keep writing. Keep writing, guys. Status lover. Priyanka. How are you, Priyanka? How is your studies going on? All well? Dhananjay, yes, great. Keep writing. You must write. Then only I will just move to next question. So interaction is very important, guys. Interaction, live interaction, very important. That will keep you awake and keep me awake. One time rating is equal to 10 time reading. Getting my point? Medico is telling, sir, thank you beta. Nice, thank you all. Okay, North RNA, love you. Okay, North roti, yes, that's great. South dosa. Next. Next I have one more image based question. Can be a 3 marks question. Now say example, our brownie is there a bad man. So see our brownie. So brownie is a bad man. Okay. Brownie is a liar. He is a habitual liar. So brownie had committed some crime and we don't know. So we are doing a test on brownie. So we will keep some electrodes. We will keep some BP apparatus and everything, and we can detect whether brownie is telling lie or brownie is telling truth. So what is this test basically? So now look at our brownie and try to answer what is the test I am doing now on brownie now. So what I will do, I will measure his blood pressure, BP cuff. I will also measure his pulse rate. I will also measure his respiratory rate, and also I will check his limb for any sweating. Now sweating is a feature of sympathetic system. So what is this test of brownie to detect whether he is telling truth or lie? Yes, come on guys, come on. Yes, very good. So this is known as polygraph test. So polygraph. So what are the components of polygraph? 1, 2, 3, 4. What are the components? So I said already, it is blood pressure, pulse rate, that is heart rate, respiratory rate, then sweating. And this is basically, all these are basically BP apparatus and all these are electrodes. So this is known as polygraph test. Very good. Dhananjay, so that's great. So many answering, that's fine. Good. SJ also answering. That's great. Then I have one very famous scenario. Again, our Brownie. So Brownie is having interest in his stepmother, and this is very famous story. Very famous story of Greek mythology. In Greek mythology, Oedipus is the son. Oedipus is the son who is going to kill his father in order to have sexual intercourse with the mother. So what is this known as? Is it punishable or not punishable? So this is Lion is answering, sir. This is incest. Very good. Incest, not punishable. Not punishable. Good. Not punishable. That's fine. Good. Many answered. Then I have one more question now. So one more interesting question from the movie Terenam. So he's Salman Khan, and a hero. Hirogiri. And we have beautiful girl here. So this Salman Khan is sending messages to this female. So he's sending WhatsApp message. He's sending WhatsApp message every day. Hi girl, how are you? Hi Pinky, how are you? Instagram also. Hi Pinky, how is your preparation going on? Are you free? He's sending repeated messages in Instagram and WhatsApp. And also he will go near her house. He will wait outside her house also. So like college also, college, house, wherever she goes, he will just follow. So my question is, what is this known as? What is this known as? And what is the BNS section for that? What is the BNS section for that? Come on, try, keep answering. Very interesting scenario. Pinky and Brownie, again, Pinky and Brownie. Keep answering. So this is known as stalking. So punishable under 78 BNS. So for the first offense, so 3 years of imprisonment. For second offense, 5 years. First offense bailable. Second offense non-bailable. Non-bailable. Now I have a question for you. So the question is, now I have a Pinky now. So I have Pinky now. So we have Pinky. So Pinky is interested in some guy. So Pinky will wait for some boy near the medical campus. She will send repeated messages, Instagram, Facebook messages and all. Pinky is sending messages to Brownie. So Brownie is a good guy. So my question now, is it punishable, not punishable? Come on guys. Pinky now. Pinky is the offender now. We discussed so many things about Brownie. Now Pinky is the offender. My question, so is it punishable, not punishable? Try answering. Dhananjay is telling, sir, yes sir, punishable. Vinay MR is telling, no punishment to female. Muhammad Unish. Okay. So this is basically not punishable. This offense stalking is only applicable to males, not the females. Okay? Yes. Chal. So this is what you can remember. 78 BNS. Don't forget. All of you write 78 BNS is equal to WhatsApp. So write this in chat box. Write this all of you compulsory. 78 BNS is equal to sending WhatsApp messages with a clear indication of disinterest from the female side. Instagram messages, email messages, following her, or telling someone to contact her, so calling her repeatedly, disturbing her privacy. So all of you write WhatsApp is equal to 78 BNS. Keep writing. Good. Good. Keep writing, guys. Keep writing. So that's fine. Then I have a question for you. Very, very important prof question. 3 marks question and one liner. Look at this. Look at this cartoon. Basically, this is a cartoon. What you can see here, husband, and here is the probably the girl or the wife, and the girl parents and the boy parents here. The girl is telling, "Are you giving a supari to kill me, Papa? Are you giving supari to kill me, Papa?" Pinky is telling. So my question, what is this cartoon related to? And what is the section for that? And you tell me bailable, non-bailable, cognizable, non-cognizable, punishment कितना होगा? तो ये सब आपको बताना पड़ेगा in next 30 seconds. Come on, guys. Yes. Try. Keep answering, guys. Keep answering. The last 10 question, last question, guys. Last question. So, 5 important points. Okay, 5 important points. So this is dowry death, domestic violence. So 80 BNS. So dowry death is equal to 80 BNS. Dowry death. Then point number 2. When wife dies in unnatural condition. If it is natural death, no problem. Unnatural condition. Within 7 years of marriage. The answer is within 7 years. Within 7 years. Point number 2. So point number 3, cognizable offense, non-bailable offense. Cognizable and non-bailable. Non-bailable. So police can arrest the husband, the parents of the husband, relatives of the husband without warrant. And non-bailable. The court has a right to refuse the bail. Okay? Non-bailable. Then punishment, 7 years to life. 7 years to life. So what are common methods of dowry death? Common methods. So one method is hanging. Commonest method. It can be burn injury, strangulation, drowning, firearm injury. So all these are possible. Okay. So whenever 3 marks question or 5 marks question, you need to write like this. So you'll get 3 out of 3. So Vinay MR, are getting my point? Or giving aconite, that is also okay. So giving aconite is also slow poison. Yeah. Snake bite. One more method is snake bite. So in the newspaper I heard about snake bite recently. Snake bite case. Murder basically. That is murder and dowry death. So it's more of murder than the dowry death. So both the kerosene burning we discussed already. So Dhananjay. So this is about 10 important images and interactive discussion. I hope you are enjoying it, guys. I hope you are enjoying this way of teaching forensic medicine. आपको कुछ समझ में आ रहा है ना? क्या लग रहा है आपको? इंटरेस्टिंग लग रहा है और बहुत बोरिंग लग रहा है? Come on guys, tell me, बोरिंग लग रहा है और इंटरेस्टिंग लग रहा है? Yes guys. Yes, yes, come on. So medico. Check. So this is about sexual jurisprudence. Then we have some more questions on 5 minutes, last 5 minutes. Okay. We'll have one more discussion today, that is about the sutures. Sutures. So all of you guys, so concentrate on this skull. Okay, I think this is visible now properly. Okay. How to estimate age? How to estimate age by looking at sutures? So this is one very common prof question. So try to answer, guys. Look at this skull now. Skull is there here. So we have sagittal suture. So this is sagittal suture, and this is coronal suture. This is sagittal suture and lambda suture. So we have lambda suture. So this is found in the crime scene, and this is the real skull. The real skull is found in the crime scene. Say example crime scene. So my question, so like see here, sagittal suture is somewhat closed from the outside. It is closed. Anterior 1/3 is closed. So my question, so what is the age of the person by looking at the skull here? Okay. So the anterior part is closed, and middle anterior part is closed, and posterior part is not closed basically. So what is the probable age when anterior part is closed? So this is again commonly asked. And look at the skull, steeping forehead is there, and you can see a rectangular orbit. Glabella is prominent. So glabella is prominent. Supraorbital ridges very prominent. Supra ridges very prominent. So this is found in the crime scene. As a forensic expert, all these are finding. Bony markings are very neatly visible. They are prominent. My question: male or female? And sagittal suture somewhat closed, not completely closed. Only anterior 1/3 is closed. Anterior half is closed. Posterior, that is not closed. So my question: what is the probable age by looking at this? Yes, Vinay, Swati. Good. Try. Yes, very good. Swati answered correctly. It is male and probably 30-40 years. So male 30-40 years. That is the correct answer. Good. So the best way to identify the age of the skull is by looking at the sutures. The best suture is sagittal suture. So all of you write, the best suture is sagittal suture. Keep writing this in chat box. Best suture, sagittal suture. Keep writing. Okay, now one more bone. So we'll have discussion. One more bone here. Okay, now one more, all of you concentrate. A practical exercise. Practical exercise. Look at this. So this is pelvic bone, right? Pelvic bone. It is found in the crime scene, like as a skeletal remains. Skeletal remains. Skeletal remains. In this, basically, the features are basically a pre-auricular sulcus. You can see now pre-auricular sulcus. Now it is visible properly. Pre-auricular sulcus is prominent. Pre-auricular sulcus is prominent. Obturator foramen is triangular. Obturator foramen is triangular. Okay. So my question, is it male or female? Only 2 points are there. Obturator foramina is triangular. Pre-auricular sulcus is very prominent. Male होगा आर फीमेल होगा, पुरुष आर महिला, ठीक है? कौन बता सकता है? एनीवन टेल मी? Yes, guys. Yes, very good. So this is basically female. So in female, pre-auricular sulcus is prominent, obturator foramina is triangular. So we'll have discussion, further discussion in upcoming classes, in practical classes. So this is about today's session. So this completes your interactive Farre series. Okay, the second class. So tomorrow class, injuries. So what are blunt force injuries? What are sharp force injuries? Firearm injuries and all. So tomorrow we have discussion like this, okay? Injuries caused by blunt force, sharp force, and road traffic accident, grievous hurt, and related most important expected question that can be asked in your third year university exam. Okay, so there are 8 classes of Farre. So 2 classes completed, 6 more classes are there. So I request everyone to attend the class and you just give me feedback after your prof exam. I am pretty sure, I'm 100% sure, so there will be many questions from this lecture. Okay, so thank you guys, thank you all. So thanks for your patience. Thank you all. Thank you. Over.